Good morning. Welcome. I don't know if we should close the doors. Welcome to this session about the Nordic Health Movement. I'm Boje Eliassen. I'm Director of Health at the Copenhagen Institute for Future Studies. And I do not think that Norway still should be a part of Denmark because I'm from the Faroe Islands. So I also want independence for myself. So you need to help me on that one. We have 4 people with us today. And first, let me just give you an overview what this is. We have worked in several settings with trying to figure out how can the Nordic countries lead the way, both for themselves in Europe, but maybe also globally. A part of it came that I was pretty fed up with going to meetings and conferences and being part of projects where the 4 bigger Nordic countries always were claiming themselves as being world champions in everything. Also when they went on the stage after each other. So slowly we began to take one-on-one with the different stakeholders and trying to get an understanding, is it likely that the countries can take this position alone, which it isn't? Is it likely that we can take this position together, which it is? And that was the initiation of this movement Health 2030, which we ran as a process with stakeholders from the 4 countries in 2019. And Anders and Line and Minna were also part of that process. And it led to some conclusions on that. For instance, by 2030, together, we should push very much forward to have a much bigger focus on prevention, not just primary prevention, but also secondary prevention and tertiary prevention, that we should align working with data across the boundaries. All of the 4 countries have a huge focus on personalized health, but all of them are too small really to realize the potential because we need to work with stratified patient groups. But also to help each other to work with patient journeys, to work with governance of data, to work with developing a welfare system that actually is fit for purpose on getting a health system which still is accessible for all and fair in it. So, we also managed, so we did this in collaboration with Nordic Innovation. Norforsk was also involved. It has been, the result has been used by, or is being used by the Nordic ministries, or the Nordic part of the political collaboration. And we have had a lot of activities from the stakeholders in this, and Anders and Line and Minna are an example of that. And just to take shortly on, Line is from E-Helse Research Norway. Minna is from Sitra and formerly from Business Finland, of course in Finland. And Carlos has nothing to do with the Nordics, but he is working with very impressive solutions that's called Teledoc Health, which he also will then relate to how can some of these thoughts, visions, and solutions also be helpful in a Nordic setting. So we're going to have short 5 minutes thoughts from these 4 people, and then we take a conversation, and we will also open up for questions from you. Hopefully you can be active in it. So I think we will start with Minna, who is one of the persons who is really pushing TEDAS and the European health data space, and where she will take a little bit of that and what that means for the Nordics and what the Nordic actually could be used for or push in that setting. Yes, Minna, the floor is yours.
Thank you, Boje, and good morning, everybody, and welcome on my behalf also to this interesting panel. And greetings from Finland. It's a bit foggy and rainy here, but anyway, let's go forward. And thanks for the introduction, and I was able to be part of this great event. As we all know, the need for a radical redesign of how we deliver, practice, and think about healthcare is really emerging across the world, and the healthcare systems are under pressure in the face of changing demographics and rising costs. And surely this pandemic has really challenged the capacity of healthcare all around the world. At the same time, the demands from citizens, private actors, and public institutions are challenging the shift of care from reactive sick care to smart and personalized and sustainable healthcare, and especially having the emphasis on prediction and prevention, like Boye already mentioned about what has been the focus of the Nordic vision as well. And the digitization and advanced technologies and therapies, and especially this utilization of data, they are really at the center of tackling these challenges and opening a huge potential for new innovative solutions in healthcare and businesses, and really transforming the healthcare, this paradigm shift, what is happening there. And as Boye said, that this was also the starting point for Nordic Health 2030 vision and this mission statement that was launched 2019. And all this it was built on Nordic values like a trust, creativity, innovation, openness, responsibility, and citizens' roles was really highlighted, because this behavior change is one of the core things that we really need to be able to do. And the aim was to propose a vision for healthcare that will ensure set of robust, sustainable, and resilient life conditions for the future generations, and of course for us as well, but still setting the scene to the future. And to meet this vision, it identified in this mission that we need to do changes in several levels. I mean that in the individual level, but also in systemic level. And we identified 3 building blocks. There is this new social contract, there is a new business model, and in the middle of everything is the new data model. And that is the engine for the change in all their angles. So the manifesto was published 2019, and the European Commission has also recognized the importance of digitization and the value of data, and taken actions to secure European competitiveness, resilience, and the data sovereignty. And the last year, the European Commission launched the European Data Strategy. And that strategy aims to create single market around the data by enabling easier and secure access and usage of data. And this is building in the multi-sectoral European data space. And this is one of the priorities of Commission in coming years until 2025. And the first action was that European Data Strategy was that what proposal was the Data Governance Act. And this act is kind of overarching perspective that addresses the data that is held in a public sector. And the idea is to stimulate the data-driven development to foster the open data for business, innovation, and policy making and research in all sectors. And the health data space is one of those thematic sectors in this European data strategy. And this European health data space, it is also a collection of actions in coming years that will boost the digital transformation and the data usage within the health sector, and build the better future, of course, to the primary healthcare, the clinical use, but then also to the better policy and better environment for research and innovation. And this health data space, it contributes so to the care delivery processes for the individual patient and residents, as well as to the secondary use of data, and also to build a single market for digital health services. That is really important for not only for business, but also for clinical use. And then the fourth sector is the AI, that how it will promote the development and ethical use of AI in health. So there is a value chain between data holders, data users across the board, and broad and complicated health data ecosystem. And the one concrete tool to create the feeds from the health sector to the Data Governance Act, and also to develop this European health data space, is this Tehdas joint action that Boye already mentioned. And the purpose of this joint action towards the European health data space is to help member states and the European Commission in developing concepts and guidelines for governance, use and sharing of health data, especially now for secondary purposes. And it also includes the citizens' perceptions of health data sharing, and then also this economic sustainability, how this can be really built. And results of this data project that will last 3 years. It will provide elements to the European Commission legislative proposal, and it will also support this pan-European dialogue that will follow that proposal. And the idea is that, was foreseeing that the proposal will come out in coming March or early summer. So the data is being carried out by 25 countries and coordinated by Finnish Innovation Fund Sitra. So Sitra took a lead on that. And there are also non-European countries, 4 countries, and Norway. For instance, Norway is involved, and UK as well. So the vision is that in the future there is a secure, easy, and seamless access to the protected health data for the benefit of citizens and researchers, companies, communities in Europe, regardless where the data is stored. And the vision of Nordic Health 2030, that included already in the beginning that Nordics, they could really frame their European development in health. And Nordic could serve as a lighthouse for the whole Europe and European development of smart, sustainable health, and bring these Nordic values and ways of working. So I guess we were a bit ahead of the that time already, and especially ahead of the EU, and especially now when the COVID pandemic has shown the strength of the Nordic societies and systems. So now I guess the momentum is now even more actual.
Yes, thank you.
I will stop on this, and I'm sure that we will have a lot of questions and nice discussion later.
Thank you, Minna, for this very good overview on the Nordic in Europe and how the Europe should become more Nordic. I think we can take that on the discussion later. And Line, you have worked a lot with the welfare state and digital health also in this part, and of course that also relates to the push in and outside the Nordics. Can you put some words on your part here?
Yes, I can try to. Thank you. I was very happy for being part of the scenario working groups and all the work we did as a basis of this panel debate. And picking up what Minna said, our goal was to make a scenario process where we got some future scenarios on how the Nordic health would be in the 2030. And then we circled around the most important person, or the most important actor is actually the citizen itself. And to realize a preventive healthcare system, you have to leverage on the citizen's ability to and will to take control of his or her life and health. And we actually agreed that if you had the correct digital support, it will enhance the citizens' possibility to take actions and to realize in total realize a society which was more had a more preventive focus and prevent, so on. And then we also had lots of discussions on what is the common goals, because we think that the Nordics are so similar, that the Nordic countries are similar in many ways. We have welfare states which are built on more or less the same idea, and then we discussed that, and we actually used the whole day discussing if we are agreed on the same values. And we didn't actually agree in the beginning, but in the end, of course, we managed to. You had the process which made us manage to realize and that we have similar ideas. But we also agreed on that if we should take advantage of the ideas and that we are so similar and we can get stronger, we need the politicians on board, and we need the politicians to help us out on how to create arenas for collaboration, so we can increase the focus on developing digital services which will enhance the citizens' own prevention activities. So just to say, in practice, when I come back to my own organization, we developed a project at NSC, which is called the Nordic Model project, where we are doing research on how the values of the welfare state actually influences on the welfare technology which is being used, and how welfare technology being used is actually influencing the development of our welfare states in a preventive direction. So we are not very far ahead in that research. We are doing, we are in the beginning, and and Boogie are invited into it, and it's an open process. So if anyone wants to collaborate, anyone has ideas on how we can do research on how the digitalization can enhance our welfare states and the ideas and the foundation of the welfare state, so that we create resilient and preventive healthcare systems, you are very welcome to participate and to contact us.
Thank you. Yes, I think also what this project that Line is heading, and I'm a proud part of as well, it's also an essential question on the role of healthcare in a welfare society, and can we actually survive with equal access to health if we are not reinventing the welfare states to be digital as well. And Anas, you have worked with some quite clear directions, also inspired by the Nordic health and inside the Nordic frame, both for a disease journey, so how a patient can go through the country seamlessly, but also on more advanced on working with data in the different countries. So please let us hear some of these thoughts from you.
Yeah, at conferences like this, it's very popular to put Nordic cooperation on the agenda. So this is not the first time the Nordics is on the agenda. It's been on the agenda for a long, long time. So it was also at the EHiN conference in Spain in 2018. And in conferences like this, just like we are in now, it's quite easy to get smart people into a room and put the Nordics on the agenda. It's quite easy to agree that we should definitely work more closer together. We have a lot of things in common. We could do and make a difference in Europe, and etc., etc. We can also come up with a lot of good ideas what to do. The challenge is just that whenever we are leaving that room, most of us is going back to a national, regional, or local agenda. There are very few that actually have a responsibility for making a difference in the Nordics. And that was the starting point of the project that I'm leading, called the Nordic Interoperability Project. And what we want to do is to make patient and health data mobility into the Nordic reality. We want to see the possibility for us to bring or to have our data available across the Nordics, either at the point of care or for research and innovation purposes. And that is a highly ambitious goal. But the goal isn't set by us. It's set by the Council of Ministers in the Nordics. They have decided that by 2030, we should be able to travel and have our data available. But then something has to happen. Someone has to leave these rooms and these discussions with a Nordic agenda. And that is kind of the initiative that I'm leading is trying to do. So we have looked into that, what we could do. And after starting up in 2018, we built, as Bogi was mentioning, what was the first Nordic interoperability showcase that we showcased at the EHiN conference in Helsinki in 2019. And there we presented the case of a patient traveling from Sweden to Finland to Denmark to Norway to Iceland, and with the existing healthcare systems, we made her data available across these systems. And by that, showcasing that technical interoperability is fully possible with the systems that we have. So that's not stopping us. Then there must be other things. And of course, there are different layers of interoperability. Semantic interoperability, legal interoperability, political interoperability, lots of those. But based on that showcase, we wanted to create the discussions, what to do with the other layer to make sure that we are able to have our data available. So based on that showcase, based on a tour of roundtable discussions in the different countries in the Nordics and a lot of discussions, we built a second version of that was ready to be presented in 2020. Well, as we all know, we don't travel that much in 2020, so we haven't showcased this physically yet. But we've also looked into, based on discussions, where could we make a difference? And based on the model that Minna was telling about, the 2030 model, where you have the system on the one side of a nice equation, the individual on the other side, and the data flowing very balancedly back and forth between those two, that is the 2030 vision. Because as we know today, most of the health data is locked into the healthcare system, and the individuals are not really involved. So where could we as a Nordic initiative take and make a change? Well, we looked into a report that came out of Nordforsk that said, talked about the Nordic Data Commons, the multitude of data lakes that we have in the Nordics with quality data. And then they pinpointed in that report that this should be combined in a way that we could use that for research and innovation purposes. Now, there's a lot of challenges of letting data travel, so we weren't able to then let personalized data travel across the countries. So then we looked into synthetic data. Was it possible to let anonymized data travel across? Possible, but still challenging. So what we're doing now and currently starting is looking into how we can move a CE-marked AI model in use in one hospital in the Nordics, move the AI model federative to another hospital and let it play on the data that is on that data lake, train it on that data, develop it further on that data, move it to a third hospital in a different country, and train it and develop it there, and put it back to a Nordic model of an AI model. In that way, showcase how we can utilize data across the Nordics for the betterment of the Nordics. If we succeed with that, when we succeed with that, we will only showcase how we can use the data from the system in a better way in the Nordics. We haven't showcased anything about how to get the individuals involved, which is an important part of the 2030 perspective. So for that reason, the second track that we are now leading is to look into how we can create an evaluation platform for digital health solutions, for apps that is common across the 5 countries in such a way that we can agree upon what is a quality assured solution and what is not. Because currently, we push the individuals to Apple App Store or Google Play if they want to be involved in their own care or in their own preventative care to find an app that I think is fun. There's absolutely no guidance from the public sector what is a good app, what is a secure app, what is an app where your data is actually safe. But there are work going on in all 5 countries in parallel. And what I'm trying to push is for these 5 countries then to try to agree what is quality and how can we evaluate in such a way that a quality solution in one country also can be made available in another country. And this can be used in the system, but definitely it's an important part to get the individuals involved in the Nordic 2030 perspective.
Thank you. Thank you. And before we take the questions and go into to further elaborate on it, Carlos, you have a lot of experience outside of the Nordic, but also one very good example inside the Nordic on what we actually can do. Please, the floor is yours. I think you're mute.
Is the sound?
Yes.
Okay. Yeah. Okay. Good. So hello, good morning, everyone, and happy to be here. And thank you, Bogi, for the introduction. And it would have been a pleasure to be there physically as well. So first of all, let me introduce who I am. I'm president of Teladoc for the international business. Briefly on Teladoc. Teladoc is a virtual care company. It's headquartered in the US. It started in the early 2000s, providing virtual care solutions in probably the most scalable country for virtual care services in the US. We had to work around regulations and being able to provide services state by state. As you know, in the US, medicine is regulated on a state basis. In 2015, company went public, and we started an international expansion, which was mainly through inorganic acquisitions. And that led me, personally, I've been involved 20 years in healthcare and in digital healthcare, to understand the complexities of global healthcare within a digital framework, but also understanding the potential of scaling several solutions, whether the technology can be scaled, but also some of the experiences in patient engagement. And I think there are basically 3 points that we can learn from our experience at Teladoc Health, having gone from the US to international. And international meaning applying digital health solutions all the way from Europe, in the UK or in France or in Spain, also in Denmark, but as well in Asia, in China, in Southeast Asia, in Australia, in Latin America, in Canada, and having the experiences of what worked, what didn't work. And I think there are 3 main areas that I believe are worth discussing, and probably we'll have a chance to touch on them. And my colleagues have certainly already touched on them. One is, how can we empower patients? How can we engage patients into the right care, whether it is with prevention tools and services, wellness? How can then we engage them into the primary care system with becoming a front door, a digital front door for them? How can we enhance primary care with technology so that the primary care can really provide much more value and service to the patient by connecting primary care with specialty care? And finally, maybe a topic about digital and physical. So how can we merge these 2 worlds, the digital and the physical, together, so that we don't confuse patients, so that we are not working on silos, but we are working all together in the advantage of patients. So I think I can talk later on in specific examples, Bogie, so I won't take more time on the introduction. Happy to get into the Q&A. Thank you.
So just before we go into the Q&A, both with the panel and with you, just to go back to one of the parts of the Nordic Health was also a common understanding between everybody was there that we are actually standing on a burning platform. There is no way we are going to be able to pay the increased cost of the health system if we just continue as we do now in 10 years. We are getting older, but we are increasing the disease burden quite fast. Every year of longevity gives half a year of disease, and we are increasingly putting more and more money into end-of-life care and not early detection and prevention. So there is a cost issue, but that cost issue is actually a minor part of the more philosophical issue on the loss of dignity in the way we actually give health. So how do we get the dignity in? And that comes back to what we heard from everybody. Where is the person in this equation? And how do we get that to work? And the other part which we did discuss a lot also is that there is no status quo. There are big players from the East. There are big players from the West. If we are not doing anything, we will just need to adapt to whatever they do, like using app stores. And if we want to harvest the data from the individual together with the system, so what Anders talked about, how do we get the both sides in, we also need to work on how do we provide value to the citizen and not just to the system in it. So I don't know if there are any questions from anybody. You can just raise your hand or just scream, and we will give you the word. While we wait and you are thinking very deeply on it, Carlos, you have an example with Danica. Can you elaborate a bit on that?
Yes, I mentioned that we were present in Denmark. We've been present there for the last 2 years and a half. And yeah, maybe as a practical example, that is in the private side of business, but this is a pension company called Danica, and they wanted to provide beyond the insurance world. They wanted to be closer to their customers and patients. So they really wanted to provide tools and solutions so that they could help them sooner rather than later and try to advance the diagnosis of disease, try to avoid unnecessary disease by really being closer to the patient. So they developed a new product within 3 areas. One, which is prevention. And so it's a set of tools and services that allow patients to really use those tools to get more information, better information, educate them. Then a second component, which is virtual care. How can you really give patients a front door to virtual care, whether it is primary care, mental health, which has been extremely relevant over the last years and months, and also chronic care. And finally, how can then you relate this to physical care? And so we launched this in partnership with Danica a couple of years ago into the Danish market. We are now covering more than 100,000 patients in Denmark. And it's really a practical example of how can you deploy a virtual care solution that aims to be closer to the patient, aims to educate the patient, but also having immediate access to the medical system, and then finally making sure that you can also integrate with physical care. Of course, in some of our discussions, we also have public healthcare collaborations. Another example that may be very practical is in the NHS in the UK, which is a big public healthcare system, as you know. Well, in that case, what we are doing with primary care is we are connecting the GPs with the consultants. And why I'm telling you this, because, well, in a public healthcare system, changes are more complicated because of the scale of the public system and the implications. But in the NHS, one of the solutions was, well, could we leverage the GP and empower the GP with technology so that when the primary care service is being provided, we can then connect them to the specialist right away online and try to avoid the waiting list or the waiting time of the patient when they have to be referred to a face-to-face appointment. Well, the truth of the experience is that 2/3 of those appointments were basically avoided thanks to a virtual connection between the GP and the consultant. So 2 examples, Danica, which is a complete private case in a pension product in Denmark. The other one in the UK with the biggest public healthcare system, the NHS. And Teladoc probably the experience of being able to do that with this speed, which is I think that Anders was talking later. How can you do these type of things? Not from just the theory, but being able to have quick wins and pragmatic approaches to it.
Lina?
I was just Carlos, when you are saying that it's harder to innovate or to change public systems than private systems, I wouldn't agree with you. Totally agree with you, because I think that in private systems as well, it's the fragmentation and the complexity which makes it hard to do the change. And in the Nordics and in the Nordic welfare state, the basic idea is that everybody should are on board, and everybody should have access to the same health services with the same quality. But maybe in private systems, it depends on how much money you're able to pay for it and how much on your income, and that's not in line with the Nordic idea of it shouldn't be your salary or your income shouldn't have anything to say about what kind of health service you get. So in a way, we have to innovate in our public sector. We have to look into it and see here too, it's the complexity, but we have to do it together, and we have to have politicians and systems and governance systems which has an inbuilt, which the ideas are built in, so that when we are doing decisions in the system, we are marching to the same goal. We all want to have a system which is for everybody, which includes everybody. Mm-hmm. And I think that if the politicians are not clear about that, then you will have ideas that, well, maybe if all the service is getting privatized, it will be a better service. We will be more able to innovate in it, etc., etc. But still, even in private systems, like you said yesterday when we talked, you've got silos and you've got a complexity, and it's also a high risk that frail and or underserved populations aren't actually served at all.
Yes.
Look to the US.
Yes, thank you. Anders?
Yeah, I think what you're addressing now, Lynn, is kind of where I feel the stress and the burning platform is to look at the speed of technology versus the speed of political systems. Because if you look at the technological development over the last 20 years, it's tremendous. But at the same time, we only have had 4 or 5 elections, which take time for a new government to come in and find their place and make decisions, blah, blah, blah. And the reason for this is that when it comes to the sharing of data, we all that work within the healthcare sector knows a lot of reasons why it's so difficult to share sensitive data. But as an individual, my bank data is also sensitive to me. I don't want my bank data to get away, but still it's available anywhere I am, across countries, on my app, whatever. So as an individual, I see that my sensitive data is able to be available wherever I need it, provided by someone. But in the healthcare sector, it's not. And I think that we as individuals would like to see that happen as well. And I would like to see that happen within the Nordic welfare model, so that the Nordic welfare model is showcasing how it could take care of us in a good way. But it has to speed up in such a sense that this is happening within the political system and not outside of, because someone is going to give us the opportunity to take care of our health data, to make sure that we have that so we are safe also when we travel across countries. And that will be a situation where those with the best education, with the most money, most technology competence, will find those solutions and start using that solution. That will be good for those of us who will start using them, but it's not the Nordic welfare model. So for that reason, I think that the political system has to kind of speed up, not because I think they are slow, just because the technological development is so extremely rapid.
Yes. So I think the discussion here is partly one election cycle has 3 iPhone updates, right?
Yeah.
3 new models.
Yes.
So just to take it that way.
Yeah.
But I think also what we hear here is how do we get a better balanced private-public partnership? Because we need both sides in this development. And can we probably also work on a level playing field where both parts have the same conditions to work under, which is probably the challenge we have, which is the paradigm that we are trying to push. How do we, because at least that's my conclusion, is that we are trying to get new technology into an analog paradigm and it just can't work. It will fail until we figure this out. And Minna, you are trying to save Europe with TEDAS. So I guess some of these things, but I mean, you can respond to that, but I'm also a bit curious to say, why did Finland choose to take the lead on pushing this?
Yeah. Oh yeah, thank you, Boye, and it was really getting a very warm this discussion already, and I was eager to participate already in the previous topic about the public-private partnership. I really agree that we can't really distinguish just the kind of make them into the silos, like a private and public one. We have to find the creative ways for collaborating in the public-private platform for this. But the TEDAS project is not only a saving a Europe, it's also a tool for each country to develop their own system for the data sharing and for the fair data sharing and those. But for your question that why Finland or why Sitra, why we decided to take a lead on that, and then I will go to the policy issues that we already discussed about that, because Finland set a national health sector growth strategy 2014, and there Finland wanted to be an internationally known pioneer country in the research, innovation, and development investments and new businesses in this health sector. And one of the key actions it included to create this enabling environment where the more wider use of data can be done using the genomic data and also the clinical use of data, but especially the secondary use of data. And one of the key assets was the longitudinal digital health data repositories and registers what we have in a national scale, and the biobanks where we have the data. And this was kind of a starting point for that. And then we started to build this innovation-friendly legislation around that. That was part of the roadmap. And already 2014, it was, I think, Finland launched the biobank law, the first kind of in the world, and then 2019, the Act on the secondary use of health data. And if you want to be a forerunner, if you want to be a leader, you have to earn it and to get your hands dirty. And when the Commission opened this opportunity that for the data's joint action, that we're looking for a leader or coordinator for that, then we lifted our hand and said, okay, well, we could do that. And as that's like the same frame like what we have in the Nordic Health Vision is that can we, our as a region or one country there to be a leader or lighthouse for taking the European development forward. So, well, that was the negotiation, and also the participating countries, they also agreed that, all right, yeah, Finland has done a good job already in developing that. So maybe we all could learn, not only from Finland, but in the meantime, we are all developing our systems and also the European space. So can we all learn about that? So it's not only the European competitiveness, it's also the Finnish competitiveness that we are now also developing. I guess that could be the long answer for the question.
No, thank you. Thank you.
Yeah.
So I think what Minna is actually telling the other Nordic countries is to get your hands dirty.
Yeah.
Exactly. And use this data as a playground, because all the European Nordic countries except Iceland is included. And so you can contribute to the European level development, but it is also a tool to develop your own environment and policies and ways of like governance models or service platform for data sharing and share experiences. And so that's how I just activate you all to participate.
Okay, good. Thank you. And Carlos, as you sit in a leading company on this area globally, and at least it's my impression that a lot of these things need to be at scale in order to make sense. So and adapted to local environment. What do you see if we take the most important trend coming in your area? Where do we apply this? What will make most impact the next 5 years? If you just can take one example.
Yeah, well, I would have many, but you touched early before in your remarks about the life expectancy increase. Europe is an example of that. The country I live in, Spain, is a country of where we have very long life expectancy as well, which is good news, regardless of COVID that has probably impacted in that. But then chronic disease is together paired with life expectancy, as we know. Already, it's more than 1/3 of Europeans that have one chronic disease, and 2/3 above 60 years old have two chronic diseases. And this is going to continue because we live longer. And then maybe the third element is the shortage of healthcare professionals that we are all experiencing. These are trends that we know. This is not theory. This is happening today, and this is going to continue to increase. And that makes the question about the sustainability of the healthcare system a very important one. How can we make it more sustainable? For sure, technology can help us, and scale, to your point, can help us. So after COVID-19, I think we've seen the reality of virtual care, but it's been a little bit improvised. So that it's not been well integrated into the systems. So what I think it's the trend that we're going to see now, the major one, is going to be about integration, interoperability of healthcare systems. So really, we are going to invest in high-quality solutions, whether it is platforms and purely technology, but as well on how we integrate the different services and different elements, whether public or private. And that will depend on every healthcare system. How do we really integrate them well into the healthcare system? So after the wave of COVID, I see we're going to see a wave of investment. There are reports about I think Roland Berger said that 12% of the healthcare expenditure is going to be digitalized in the next 5 years. And that itself creates a huge industry by itself, which Europe can be the leader. And certainly the Nordics can, and I think will be the leaders.
And maybe we can activate some of the oil money in some of the Nordic countries to lead that. Who knows? So, Line, what about Norway?
What about Norway? In what way?
I mean, what does this mean for Norway, and what do we need from Norway on this
To
part?
realize a Nordic collaboration.
Yeah, both to realize the health and the Nordic collaboration. Yes.
Yeah, oil money, yes. But okay, jokes. No, I think that Norway would have to. We have to think outside of our national borders. When you look at the Norwegian e-health strategies and action plans, etc., there's nothing there about international collaboration. There's really nobody's actually pushing for Nordic collaboration or international collaboration. And of course, I guess that both the directorate and the ministries, etc., and all the other actors are actually collaborating and they're participating in the Nordic Council, etc., etc. But I wish we had like yesterday, the lady from the Cancer Association in Norway on the opening session, she said that she referred to the EU's mission on cancer, mission statement on cancer. I wish that we would, in all the different, all the Nordic countries, that we would have now after COVID, that we would have a mission to participate together, to collaborate together on how to utilize digitalization based on the experiences we have now with COVID in order to realize a resilient, sustainable system which is in line with our Nordic values. But I still miss it. I think that when you experience a pandemic like we have done now globally, you actually see that as a political scientist, you see that healthcare is a very national jurisdiction. It's the nation, it's the national government, it's the governments who are responsible. I mean, we closed the borders to Sweden, and Sweden now are a bit angry or a bit sad that we did that, because we are neighbors, we are best friends, and we should stick together. But still, you see in the COVID situation that we actually closed and we became we were very looking inward in our own system. So if we are going to realize the future and to harvest values from the strategies which Finland is leading, we need to open up and we need to embrace Nordic collaboration on a much higher level than we do today.
Thank you. Anders?
Yeah, since I said in the beginning that we need someone to get up in the morning and think Nordic instead of national, so that's my role to play. I know there's a lot of people that get up in the morning and doing great jobs on interoperability, sharing of data on a national scale or regional scale. So there's a lot of great work being done in all of these countries, also in Norway. But as Line is referring to as well, we need to put the responsibility somewhere on the Nordic kind of cooperation if we mean something about it. And the Nordic Council ministers, consisting of these 5 countries, have decided, we have not decided, they have decided, that we should have a situation in 2030 where we can be traveling and have the data available. So then we have to make it happen, and someone has to be responsible for that. And I see that the Nordics have some really historical background and some really good ways of working that make that cooperation much easier than the next step, which is in Europe. So what now Citra and the TEDAS initiative is doing is nothing that we are, from a Nordic perspective or from Nordic interoperability perspective, anything against. We just think that we, the 5 countries here, can have a great opportunity to be the stepping stone to something bigger.
Yeah, I mean, if at least my understanding is that the data in the Nordics is both deeper and wider than you can find in other places.
Yeah.
But we are beginning to get a challenge with that it's easier to access data in which is produced outside of the Nordics. So we are losing that edge. But if we then also push it a bit more and saying, if we don't do anything, does that have a consequence for Norwegians or Nordic citizens? Because, I mean, at least with my knowledge, pushing towards personalized health, small countries, 5 million, 10 million, will just lose out because the volume of citizen is just too little in order to be able to provide the necessary care, if we think 10 years ahead. So, Mina, I don't know if you see also this TEDA's push forward as a necessity to save ourselves in that way.
Yeah, you might say so. I also think that.
Yeah, I think I wanted Mina to answer.
Okay,
yeah,
sorry.
I think.
Are we counting on TEHDAS? Is that the only only way? No, I wouldn't say that. It's only a one tool, and but it's a good exercise also to build on the Nordic collaboration as well. Because as I said, that except that Iceland, all the Nordic countries are involved, and they are playing a big role in that. And like task leaders, work package leaders, and so on. So that's a way of also developing the Nordic collaboration. And I also like the approach that, Anders, you lifted up about the role of more bigger role of Nordic Council of Ministries, Nordforsk, and all this. What already we have these organizations and bodies in place. But what is our joint commitment? What is our joint vision? And anyway, well, when we pull all together, we are about 30 million. So it's not that small anymore. And when we apply all these digital platforms and technologies and sharing of data or e-services, this could be a pretty great a region for working or living or doing whatever, and also to work as a I would say the lighthouse for the whole Europe. But but I guess if there was a question also that what Norway should do, and I think that was also something, and I don't know if you realized that maybe a month ago there was an article published about Open Data Institute, a report on the secondary user health data in Europe. And Norway was positioned in the leading group. There is 4 groups in the rankings. So there is a leading group where the quality of policy is stronger and the state of implementation is more advanced. And there were 16 countries and Norway was among of that. And it was recognized that in Norway there is the plan for kind of health research and importance of data and technology is realized in research and innovation, but still how to set out the platform for a secondary use of health data that can be used for the innovation. So that was kind of lacking. So good access to the data for research, but what is this explicit legislation that allows the use of secondary health data for innovation? So the survey stated out that there is a policy momentum now for Norway, and how you can really use already existing great things you have, like this centralized data service, this health data, and one-stop shop. So you can build on those assets that you already have, and then widen it, and then taking this more international approach as well.
Yes, thank you. And Carlos, what do you think, seen from your perspective, is the one most important thing Norway should bet on? If you can do it a bit short, so we also can have the last round.
Yeah, sure. Yeah. So maybe the one thing that's still missing, and it's still a barrier to the development of virtual care globally, it's regulations. Through COVID-19, we've seen some regulations being lifted, and they were extremely helpful for many populations. In fact, in our case, we even were helping in several countries with COVID-19. We covered underserved populations from India to Asia, providing service. But one of the barriers, as I said, is regulations. So maybe there is a chance that Norway can lead the way in develop the new regulations to thinking about the patient always, putting the patient first. How should we organize healthcare and how we should integrate digital and virtual in favor of patients and try to define that framework, I think that could be a role model for not only Europe, it could be the role model for virtual care globally if we really do it well. I think that's the one thing that I would hope to have.
Thank you. Thank you. And then a last round here where you each get 30 seconds. So when you start on work tomorrow, because you are very tired for the rest of the day today after the session, so you can't do anything more, what is the thing that you are doing that will lead us to a more sustainable health model in 2030? Line.
I will continue working on my PhD, the papers I'm writing in my PhD on the governance model in Norway. And of course, when you discuss the governance model in e-health in Norway, I also have to analyze and discuss it in a global perspective and how to govern these developments in the light of the development of big tech and other big and global actors. They're important.
Thank you. Anders?
I will continue to have take upon me a Nordic role and a Nordic task on that. So continue to work on the common solutions for the Nordics.
Mm-hmm. Minna?
Well, I will get my hands dirty and tap them into the data project publications. We have already done several of them. Recently, the most recent is the user journey to the cross-border share of data. So there are more to come. So I need to go and review them and before we go take them to the steering group meeting. So that's one of my major things tomorrow morning.
And Carlos?
Well, the one thing I'm working very hard now is on developing an R&D effort for our company to be based in Europe. And in fact, our CIO, who's based in New York, the Chief Information Officer, he's a Danish. And so I'm working with him in bringing some of the R&D assets into Europe, especially on the technology side of medical devices and smart medical devices.
Okay. Thank you. I don't know if anybody has a question. You need to hurry up if you want to ask something. Or you just want to be laid back Nordic, which is also okay. But I don't know if it takes us to 2030 in the way we want. But thank you very much. Thank you for coming. And thank you, Minna and Carlos, from the cyberspace, and Line and Anders in real life. So, yes, thank you all. And of course, we are here if you have any questions.